Hazards of diathermy. Diathermy is a therapeutic technique that uses high-frequency electrical currents to generate heat in tissues, often used for physical therapy, surgical applications, and coagulation. While diathermy has many benefits, there are several hazards and risks associated with its use, which must be understood and mitigated. Burns. Cause: overheating of tissues due to excessive energy or prolonged exposure. Risk areas: skin, underlying tissues, and internal organs. Prevention: proper device calibration, use of insulating materials, and patient monitoring during treatment. 2. Electrical shock. Cause: faulty equipment, poor insulation, or improper grounding. Consequence: can cause pain, burns, or even cardiac arrhythmias. Prevention: routine maintenance of equipment and adherence to safety protocols. Fire hazard. Cause: use of diathermy near flammable materials such as alcohol-based antiseptics, oxygen, or drapes. Consequence: fire or explosion, leading to severe injuries. Prevention: avoid flammable substances and maintain a safe operating environment. 4. Interference with medical devices. Cause: electromagnetic interference, EMI, from diathermy equipment. At risk: patients with pacemakers, defibrillators, or other implantable devices. Consequence: device malfunction, leading to life-threatening situations. Prevention: avoid use near patients with such devices or opt for alternative therapies. 5. Tissue damage. Cause: misapplication of energy or incorrect electrode placement. Affected tissues: muscle, nerve, or bone tissue. Consequence: localized pain, scarring, or functional impairment. Prevention: training of practitioners and strict adherence to treatment guidelines. 6. Infection. Cause: contamination of electrodes or inadequate sterilization. Consequence: local or systemic infections. Prevention: use sterile equipment and follow infection control protocols. 7. Overheating of implants or prosthetics. Cause: metallic implants such as joint replacements absorbing heat. Consequence: tissue damage, implant loosening, or patient discomfort. Prevention: proper screening for implants and adjustment of treatment settings. 8. Misuse or operator error. Cause: inadequate training, fatigue, or lack of understanding of equipment. Consequence: increased risk of burns, shock, or other injuries. Prevention: comprehensive training and certification for practitioners. 9. Potential carcinogenic effects. Cause: prolonged exposure to electromagnetic fields, though evidence is limited. Consequence: theoretical risk of cancer development. Prevention: use diathermy within recommended guidelines and limit exposure duration. 10. Neurological and sensory effects. Cause: high-frequency currents stimulating nerve endings. Consequence: tingling, numbness, or muscle twitching. Prevention: adjust settings to avoid unintended stimulation. Safety measures. Perform regular equipment maintenance and inspections. Use appropriate grounding and shielding. Ensure patient awareness and informed consent. Maintain proper room setup, including the absence of flammable materials. Monitor patient response continuously during therapy. By understanding and addressing these hazards, healthcare providers can maximize the therapeutic benefits of diathermy while minimizing risks to patients and staff.